My name is Cassandra Sutton, and I would be happy to share my recreation therapy internship experience with you in this video. I completed my internship at the MetroHealth Rehabilitation Institute of Ohio, which is located in Cleveland, Ohio. My contract began on January 12, 2015, and it will end on April 17, 2015. CTRS Justin Terrace was my clinical supervisor. MetroHealth is a public post-acute inpatient hospital with specialized units for traumatic brain injury, stroke, and spinal cord injury. The average length of stay for TBI and stroke patients is 2 to 3 weeks. The length of stay for patients with a spinal cord injury can be as long as 3 months. The youngest patient admitted during my internship was 16 years old. We did have a fair share of geriatric patients as well. The majority of patients served have lower socioeconomic backgrounds. With that said, about 1/3 of patients are injured due to drug and alcohol use. This CARF-accredited facility has 63 beds. The referral system for patients is physician-ordered. The entire treatment team is composed of medical doctors, nurses, psychiatrists, OT, PT, speech, rec therapy, social workers, and volunteers who are a great help to the recreation therapy department. The recreation therapy room is where most of our programs are held. We also serve patients on a one-on-one basis on their floor or in their actual patient room. Oftentimes, a long-term goal for patients is to stand while playing pool or basketball once cleared by PT to do so safely. The next few pictures give you an idea of the supply room full of our department's supplies for programming. The RT department is held accountable for active treatment by adhering to thorough documentation on each patient placed on program. Now I'm going to briefly walk you through the process. The first step is a patient chart review and an assessment, which is in the form of an interview with the patient. Step 2 is the process of taking data from Step 1 in order to complete a treatment plan, which is then added to the patient chart in order to be visible to the entire treatment team. The third step of patient documentation is a progress note, which is in the format of a SOAP note. The last part of patient documentation is the discharge note. Attendance in programs must be tracked not only for the purpose of writing progress notes, but for billing for services. Documentation deadlines ensure further accountability for our department. During daily treatment team meetings, I was able to provide updates on patient progress in recreation therapy. So, by keeping up on individual treatment plans, this is my chance to communicate to other disciplines how the patient is performing. This room has been filled with as many as 18 healthcare professionals during a meeting. Reporting in these meetings has been a great learning experience because I had practice in communicating the progress of each patient in RT. This is a picture of the therapy gym where physical therapists and occupational therapists work with the patients. This is a picture of one of our most popular programs, which is ice cream making in the therapy gym. One unique program that I brought to Metro was knitting and crocheting. As with every activity, some patients required more assistance or physical adaptations than others. Some simply needed build-ups or grips on their needles and hooks. Some patients with cognitive impairments required more cueing, while SCI or stroke patients may only have the ability to hold one needle, so we would work together to complete projects. One of my most memorable experiences at Metro was knitting with a geriatric patient on the TBI unit. Prior to her participation in RT, she was anxious and apprehensive to make progress in physical therapy for fear of falling or making mistakes. During team meetings, other staff members reported how she was showing several depressive symptoms. This patient also had cognitive impairment secondary to dementia. Once I began knitting with her, she showed fewer anxious and depressed behaviors and had renewed confidence in PT. The physical therapist even began to encourage her to knit during PT sessions while taking breaks. It was so satisfying to see how introducing the right treatment modality can treat the patient so holistically. Many of our programs challenge patients to work with their hands. When I first began at Metro, I worked on the TBI floor. When the recreation therapist on the SCI floor ended her employment in early March, I assumed her caseload. Working with patients with SCI was new for me, and I learned about the Asia SCI functional assessment. This tool was a great indicator for what the patient's long-term goals might look like. With this newly assigned caseload, I carried more responsibility. I promoted and assisted with the Northeast Ohio Spinal Cord Injury Chapter meetings. I coordinated the chapter's newsletter. I also planned SCI patient education classes for the month of April. At that point, I began to have experience in advocating for RT and other community resources for this patient population. One of the chapter meetings was even about an accessible golf program with specialized equipment for moderate to severe physical impairments. Best of all, it is free and ran by a PGA golfer and a team of physical therapists and trainers. Dr. Johnson would be so proud. As I look back on my time here, I am able to say that I am a recreation therapist who can work with patients with cognitive impairments as well as physical. During my internship, I excelled in organization and time management, which I feel UNCW has prepared me for. I am also so excited about the job opportunities I already have lined up here. UNCW will prepare you for your internship, but it is up to you to get some experience under your belt. Don't look at volunteering as unpaid work. Look at it as an opportunity to decide which population you are passionate about, and also a resume booster. To wrap up, I would like to thank Dr. Johnson, Dr. Ashton, Ms. Mooneyham, both the Kinneys, and Dr. Crow for your teaching and mentorship.